Will, and I'm going to be talking with Shauna today. We have finished her braces, and now we're going to be giving her retainers to her. So retainers are a very, very important part of braces. In fact, it's just as important as the braces. So Shauna, I want to show you what your retainer is going to look like here. This is your retainer that we have made for you, and it's on a model.
Okay.
Get my gloves on here quickly for you. And retainers are to be worn all of the time, 24 hours a day, Shauna.
For how long?
I want you to do that for a minimum of 1 year, please. Now you may take them out when you eat. That's perfectly acceptable. I'm going to give you a case to keep those in when you're not wearing them, because we want the retainers to be protective. Many times we have patients that put retainers in a napkin or in a backpack, and they get broken, stepped on, and I do not want to have the expense of repairing a retainer for you.
Okay.
So, looking at the retainers right here, you will see that this particular retainer has a wire on the front and it has plastic on the inside by your teeth. So when you take the retainer in and out, it's very important that you do not touch this large long wire here, but you take the retainer out by pushing down on the loop. And I like to suggest that you do that on both sides simultaneously. That way it doesn't put any pressure on the wire.
Okay.
Now you can see what this retainer looks like here. Some people say, how do I tell a top retainer from a bottom retainer? Well, the top retainer fits on the top of your mouth, so it has a lot of plastic up here. The bottom retainer, which we will look at a little bit later, has just like a thin line of plastic because it has to allow room for your tongue to move. When you put the retainer in, and I'm just going to show this on the model right here for you, we put the wire in front of the teeth and then just push up on the inside. It may have a slight snap at the present that will loosen up as you wear this over the next few days, few weeks. That's very normal. We do not keep tightening the retainers, because if you tighten the retainers, you are eventually going to cause the teeth to crowd up and become crooked again. Obviously not what we want to have done, because we work so hard not to do that.
Right.
So there we are. So let's review this just a little bit. The retainers always go with the wire in the front, the plastic behind the teeth. You take the retainers out by pushing down on these loops on the side. You put it in by putting the wire in front of the teeth and pushing up on the plastic.
Okay.
You take these out to eat. Please store them in your case that we will give you. Before you put them back in your mouth, brush your teeth and then brush the retainer just with a regular toothbrush. When you have put these in and out of your mouth for a few days, you will feel that the initial excess saliva, a lot of saliva in your mouth, will go away. And also some people think that they lisp a little bit when they wear the retainers at first. That goes away in a day or two also. So keep swallowing, keep talking. Okay? That's the best way to get used to retainers. We'll wear these for a year full-time like I mentioned. And retainers, just like your teeth, are a lifetime investment. So that after that first year has passed, I want you to wear the retainers at night for indefinitely.
Okay.
And you know, when you're sleeping, who cares? Your teeth will love it. It'll keep their smile the way you have it right now, and that's your assignment.
Great.
Any questions?
No, I think that's it. Thank you so much, Dr. Will. I love my new smile.
We love it too. Thank you for letting us help you.
You're welcome.
Great.